Hey everyone, welcome. I'd like to introduce my special guest today, Dr. Chris Besant. She is amazing. I know she does a lot of stuff with herbs and food therapy, so you know that's right up my alley. Whenever we're talking food, I get really excited because food is the foundation of life and we need to offer good things in the bowl or on the platter. Chris, thank you so much for agreeing to be live with me today.
Oh, absolutely. I'm excited to be a part of your amazing mission. I mean, you are amazing.
It is a big mission, and it's gotten much bigger than me, which is great because we have so many people that now are understanding the importance of food and the importance of high quality food.
Exactly. Yep.
So what we want to talk about today is prescription diets, because we know that those are such a huge part of veterinary medicine. And unfortunately, for the majority of veterinarians, what they learn about nutrition in school revolves around prescription diets. And they tend to be prescription diets made by the very large pet food manufacturers, which means they're highly processed and, in my opinion, made with really suboptimal ingredients.
Exactly.
And what most people are not aware of is that prescription diets do not contain medications.
Right. Absolutely.
So can you address that fact of, like, why do we have to have a prescription for something that doesn't contain medication?
Yeah. I would say that unless the diet is complete and balanced, and unless the diet could be fed to all adult animals, then you have to look at what are the restrictions. So, for example, in Medicus veterinary diets, the only ones that are by prescription are the 2 kidney diets, so the feline kidney and the canine kidney diet, and the feline bladder diet. And the reason they're by prescription is because the minerals are so restricted that it would not be healthy to feed those diets to a healthy animal. So if you fed the canine kidney diet to a healthy dog, you would slowly but surely deplete the phosphorus and calcium in their diets. And so it's not that it's a medication, but it's selectively taking nutrients and either restricting them or adding more of them to be very specific for that animal's physiologic shortfall. So in kidney disease, of course, the kidney, when it's damaged, can't process phosphorus properly. And so phosphorus builds up in the blood. And so one way to be able to minimize the amount of phosphorus that builds up in the blood is minimize the amount that they're eating.
Right.
So that's number one, is restricting the amount of phosphorus. But then the other is in the Medicus kidney diet, we added phosphorus binders. So binders, whole food binders, so eggshell and chitosan, as whole food binders. So when they eat the diet, the majority of phosphorus stays in the colon and is excreted with the stool. So if you took that same restrictive phosphorus binding qualities and fed that to a healthy dog, you would restrict them in the amount of necessary phosphorus that they need. So really, that's where it becomes by prescription, is I believe that a veterinarian needs to be involved when you're restricting something. So if you're restricting phosphorus, you need to have your veterinarian involved. If you're restricting, like in the bladder diet, it's magnesium and phosphorus and calcium. If you're restricting those, you really need to have a partner that is working with the pet, that is running the blood work to make sure that they still have enough, even though it's restricted in their diet.
Now, so for a kidney failure animal, obviously, if we're restricting things, it's because their kidney disease is advanced enough that we need to be restricting. Because in stage 1 and stage 2 kidney disease, we don't need to be restricting phosphorus. Those are usually fine. And so we don't restrict until we get to like second or third or fourth stages of kidney failure. So for instance, in your bladder diet, where we're restricting minerals, is that meant to be a long-term usage or is that a short-term usage? Because let's say we have an animal with bladder stones or a lot of crystals who's 3 years old or 4 years old. We don't want to restrict those minerals for life.
100%. Absolutely. And I think that, God bless veterinarians and the big pet food that produce these RX diets. They acknowledge the fact that different nutrients matter, and that is super important. But what hasn't happened is the proper utilization of it, meaning that you should use it for short term. Let's get the crystals under control. Let's get the pH back to normal. Let's get the inflammation of the bladder under control. If there are stones, particularly struvites, let's provide a diet that's going to dissolve those struvites. But then, after they're back on course again, now let's get them on a healthy, complete, and balanced diet that has a good amount of minerals, not excess. So I would say our next step is to do a complete and balanced diet that hits the minerals that they need by AAFCO standards or by FEDEX standards, but not so much that it would lend towards recurrence of crystals and recurrence of bladder stones again. And I think that we've really, I'm older, I'm not saying anything about you, but having been doing this for now 35, 36 years, what we saw is in the beginning when we used CD or a diet that was geared for struvite crystals, we modified the pH, and by modifying the pH, now we've lent ourselves to oxalate crystals.
Exactly.
Yeah, and it used to be when we first started, it was all struvite, and like oxalate was like, you hardly even knew about it, right? Because it was always going to be struvite.
And we see, I started seeing kidney stones, which are almost always oxalates, where we didn't have that before. And so we had some bladder stones or some crystals, but we didn't have kidney stones. And now we see a ton of kidney stones. And I think it's because we've reversed things too much.
Exactly.
And it's also because very often, particularly with cats, but I see it with dogs too, things like CD or urinary SO, pick a company. I don't even know the initials for the Purina one. Maybe that's the SO. But we get these diets that, again, are meant to be used for short-term use, but literally people will say to me in an email or a social media message, well, my veterinarian says that my cat or my dog has to stay on this prescription diet for the rest of their life.
Yeah.
And I think that is just so not true.
Correct.
And so unhealthy.
Exactly. I mean,
because we're causing problems by doing that.
Absolutely. Oxalate stones were not an issue. Not as big, not as common as they are now. But now when you look at it, struvite stones and oxalate stones are about the same in incidence. And the reason being is because we overfed. And I can appreciate the pet parent who's like, oh, I don't want to go through a blockage again. I will do whatever doc, whatever you tell me to do, I will do. And I think that most vets probably didn't truly understand how strong it was and how strong nutrition can be. Yeah. And that by making huge changes in their mineral content or also in the pH is enough to just throw them off to the other direction. But nobody's paying attention to that, And here's the important part. Once they've gone from a struvite to an oxalate, what are they going to do, right? So now they'll surgically remove the oxalate stone. But what is their choice? Now they're going to go with a urinary diet that's geared for oxalate stones. So now the pendulum is going to swing back to struvite again. And it's scary, but I do think that vets need to counsel their patients and say, okay, 6 months, his last 3 urinalysis have been fabulous. Let's get you on to a healthy, whole food diet that has a proper amount of minerals so that that's what that kitty can be on for the rest of their lives.
Right.
And we just don't do that. I think that this whole concept is once you're on hydrolyzed protein, you're on it forever. And that's craziness. It shouldn't happen.
It is absolute craziness. So what other diets besides the kidney and the bladder, what other diets do you have in your Medicus line?
Yeah, kind of the way I looked at it, and I'm sure that you'll agree 100%, is we could either be restrictive in a diet or we could be additive in a diet. And so, for example, the kidney and the bladder diets, those are restrictive. The ones that are additive would be like our cancer diet. And our cancer diet is, to me, it like gives me goosebumps because it's like the healthiest, most wonderful food that you could imagine feeding to your sick animal. And it's ketogenic, so it's really low in carbohydrates. It is flooded with antioxidants from all different sources. It's flooded with omega-3 fatty acids, and the fruits and vegetables are all organic, and the meats we test for biogenic amines. And so the meats are of the highest quality human grade meats, but also have a really low biogenic amine, which means that it's as fresh and healthy and vibrant a meat as it could possibly be. And interestingly, even though we call it the cancer diet, it really is not just for cancer. It's for all dogs that you want the optimal, best possible diet I could afford. And that's what I would use. So it could be awesome. For a dog who's not thriving, a dog that had blastomycosis and was sick for a long time and they need to come back. That would be the diet that I would use. So the cancer diets are very additive. You know, we looked at it and said, first it's species appropriate. And then after the species appropriate, what is the cleanest, healthiest, most vibrant food that we could possibly produce, knowing that when a dog has cancer, when a dog is sick, every bite matters. Yeah. So every single bite, and if they'll only take 10 bites, it's 10 bites in the right direction.
Exactly.
Because what I saw in my veterinary practice is people would give up. You know, their dog's like, I will eat nothing but rotisserie chicken. And I can't argue with that. Yeah, absolutely. If that's the only thing he will eat, eating is better than not. But
absolutely.
What if we could get them a complete and balanced, wholesome, clean, ketogenic diet? This would be the option for that. So
is that particular diet more calorie dense or nutrient dense than your others?
It is. Yeah, they're in the 5,000 kcal per kilogram range. So they're high. We have egg in it, and we have cottage cheese in it, and we have like all these amazingly wonderful foods. And every bite is going to make a difference for them.
Very critically important. I've got a 16-and-a-half-year-old guy who has heart disease and neurologic issues and bladder cancer. And he has been such a great eater, and he's had like 20 supplements, you know, all of his herbs and his antioxidants, his mushrooms, all these tinctures and stuff in his food. He's been so good about eating it for the past 8 months with all this stuff in there. And about a week and a half ago, he said, no more. I will not touch a drop of food if it has anything in it.
Right.
Now, you know, so there comes a point when you say, okay, I really would love for you to have all these things that have been keeping everything at bay and in control. You have now said no. So this is where you need that caloric density and you need that really high quality food, because you're not going to be able to add all those powders and liquids and things. Luckily I can, you know, the tinctures, he's very good about me dropping in his mouth, but I've been playing around. I'm like, okay, I'd really like you to have your melatonin. And so I sprinkled that in a little tiny bite of food, put that next to his mound of untouched food. And he ate the mound and then smelled the other and said, no way. And I have tried it with like 6 different of the powders.
Yeah.
If he smells anything, he says, nope. But the great thing is he's eating like a champ again because there's nothing in his food.
Yeah.
So there comes a point, and so I love that if you're going to feed, you do want to make every bite count, particularly if you've got multiple things going on where, at any moment their appetite can go down the tubes.
Yeah. Another one that
so what
do a
yeah, I was gonna say, what other awesome things do you have?
the sensitive stomach diet, incredible. And the people that email us every day with stories about how fabulous their dog is just so heartwarming and really.
What's your protein source in that?
Beef.
Oh, interesting.
Let me pull this up. So it's and the reason that we use beef in it is that we are in Wisconsin, and so we have these really great. So it's beef liver, eggs, and then rice and all sorts of krill and other wonderful things. But we produce in Wisconsin, and in Wisconsin, we literally do not even have feedlots. So every cow that is harvested from Wisconsin is grass-fed. And they're all low stress because they're all kind of hanging out in pastures and enjoying their lives. But yeah, so you'll see in our diets, we do use a fair amount of beef because we have such fabulous, low stress, grass-fed, happy cows that all of those chemicals of stress go into the meat as well. And that's things that we don't even test for, but you and I and everybody intuitively knows that if an animal is highly stressed, their meat is going to have all those stress hormones in there. And then your pet or yourself are going to eat that. And especially when they're sick, that's the last thing that they need. So the sensitive stomach diet is this really great diet that is all about super high fiber. And we added probiotics and prebiotics and cinnamon and ginger. So we had herbs that are nourishing.
Warming things for the tummy.
Yeah, nourishing the gut. And it's a way to try to help balance the microbiome from a nutrition perspective. Because, we can talk about FMTs and oral probiotics that we give and prebiotics, but ultimately, it's really about fiber, and it's about moving stuff through the GI tract and bringing down the inflammation in the GI tract while we're inoculating the gut with good flora. So the sensitive stomach diet has been amazing because it's really just super clean, super high fiber, and all the things to re-inoculate the gut. And then we have another diet called the bland diet. And the bland diet is literally just hamburger and rice, and then we added some cinnamon and ginger and licorice to it, and we added some things that will help bring down inflammation and aloe. But it's ultimately so that if they have a flare-up, instead of doing, after NPO, then you would add the bland diet. So after you took them off of food for 24 hours or so, and you would start back with the bland diet, and then you'd go back to the sensitive stomach diet. Because how many
is the bland diet a balanced diet, or is that a short term?
That's short term, exactly. Okay. It is not complete and balanced, and it's not a long term thing. It's something that you have on hand for a flare up, and then use it for 3-4 days. They start producing good poop again. They're feeling fine. Go back to the sensitive stomach diet.
Awesome. Are your diets gently cooked or raw, freeze-dried? How are they?
All the fruits, vegetables, and meats and organs are raw, coming in, and then we blend them and grind them and form them into nuggets, and then the nuggets go into IQF, which is a quick freeze system that makes it into like little marbles. Those little marbles then go into freeze dryers. And then in the freeze drying process, we have a freeze dried pasteurization step. And it's making use of hot bulb heat bulb, BULB, hot bulb heat versus cold bulb heat. And what that best explanation for it is, when you're in a really humid environment and it's hot, it's super hot. So in Wisconsin, where it's very humid, 90 degrees, you're like dying. But in Arizona, where it's really dry, you could be at 90 degrees and it feels like 70 degrees. So what happens is when we freeze dry something, we wait until all of the moisture is removed. So the water activity is really low, the moisture is less than 4. Then we subject that material to either a flash of 165 that would kill any pathogens, or a period of 3 to 5 hours at 130 degrees. And so what we've done is literally done 2 studies where we inoculated the food with pathogens, and then we went through the process, and then we tested how many pathogens were left at the end. And either one of those approaches will provide a 5 to 6 log reduction of any pathogens. Then, on top of that, we test the finished product. So then it gets sent off to a third-party lab, and if it comes back clean, then it moves on into packaging and is packaged. So it's as close to a fresh, raw diet as possible, but also being pasteurized. So for any dogs or cats that are immunosuppressed, they're not going to have to worry about a pathogen load.
Which is awesome. And, having a freeze-dried product makes it much easier to ship, much easier to store. You're not paying to ship frozen products, which is just ridiculously expensive these days, dry ice and everything else. So it's a very smart move to do it that way. Plus, for storage for pet owners, people who travel and want to take their pets with them and want something that's clean and easy to travel with. I deal with a lot of clients whose dogs are going over to Japan for heart surgery, and being able to travel with food for these animals is good. With healthy food. And so I've spent a lot of time with a lot of clients figuring out what they can travel with, depending on which country they're starting in, and what the import export laws as well when you're traveling with food can be just really challenging.
Yeah. And the beauty is if you add moisture back to it, it becomes like the beautiful food that it was before. So it smells good, it looks good, it is. So you're not carrying that water around with you. Wherever you are, rehydrate it, and then they can eat a really fabulous diet. And I think what we've seen is all of the holistic vets that are out there talking about nutrition have really converted the way that we think about feeding our pets. Remember years ago, people would be like, I would never feed human food. Like, doesn't that just make you cringe? Like,
it makes me cringe. I have to do an interview on that later today, and I'm just like, oh my gosh! Like, I'm not going to say the things that you scripted for me to say, because, there is no such thing as people food. There's food. Yeah. There's real whole food, and then there's processed yuck, filled with waste products.
And neither should a dog. But I think we've gotten really good.
I have to be willing to eat anything that I would put on my pets' platters. Yeah. And so I have eaten my pup loaf recipe, which, it's a little gritty, and I would say it needs salt if you ask me, because I'm a salt fanatic. But other than that, it's like, okay. And it's a little fishy because it has sardines in it. But I have eaten it. I've eaten it live on camera. So, if that's really the level of food that I think all of our pets should be eating, all of our patients should be eating.
Absolutely.
And I think that the veterinary profession, unfortunately, has just gotten away from fresh whole food feeding for our patients. And I'm telling you, like, once you have a few patients that you take them off that highly processed food and you put them on real food, the changes are so dramatic. It's like, I don't understand how you could do that and not question the other stuff that we're prescribing and feeding. And
right. So what we see is that people feed their animals really well their whole lives, and when they get sick, Now you find yourself walking out of the vet clinic with this big bag of heavily processed food that you would never, ever have fed your dog at any other time, but you're afraid. And it's your vet recommends it. The vet, that's all that they know, so they don't even appreciate that Medicus is out here, or even that the amount of like homemade recipes are getting to be so good these days. Meaning that if you could cook for your own dog, that's the absolutely ideal. In my opinion, I'm sure in your opinion as well. And if we could produce really fabulous recipes for animals that are sick, fabulous. That's really ultimately what we should be doing. But realistically, your dog is sick, you're upset, you still have to live your life, but you want to do anything possible. And that's really kind of where Medicus comes in, is that if you can't do it all yourself, if you love the idea of cooking for your own dog, but you didn't have time this week. Okay, here's another option.
You need a backup plan. Always have a backup plan.
Right. And so I think we've kind of gotten pet owners to think about it when they're healthy and vibrant. Now we need to have them continue that same thought process when they're sick, because that's when they really, really need a good foundation of health. And what I feel like when you give them that bag of heavily processed, dry, therapeutic kibble, you're actually taking them from a high plane of nutrition to a low plane of nutrition with all sorts of bad things, that chemicals like AGEs and things like that are in this food, that's the last thing your pet needs when they're sick, is to go from a healthy whole food diet now to a heavily processed diet. So I'm excited about where we can go with healthy pets and how long they can live vibrant, healthy lives. And here's how I feel about it. And I know you probably think the same, because we're both kind of based in Chinese medicine. But when they get sick, they're kind of bouncing off the road in life. And we want to get them back on track again, but then feed them healthy food from that going forward, not necessarily prescription food their whole lives. And
exactly.
When I was talking about the sensitive stomach diet, to me, that's a replacement of the goofy hydrolyzed diets. And so lots and lots of dogs are going from a hydrolyzed diet onto a whole food sensitive stomach diet and doing amazingly fabulous on them.
Yeah. I mean, the hydrolyzed diets make me absolutely crazy. I'm like, who would think that hydrolyzed chicken feathers, hydrolyzed soy, or hydrolyzed chicken liver is the perfect diet for your pet to eat for the rest of their life? It makes no sense at all. So
I agree 100%. I never understood it, but it's such big business. And again, it's, to me, is preying on people's fear, preying on their fear of, I will do anything because I love my dog so much that if you say to do this, I will do it. And no vet's going to go, well, it's not good, but it's the only thing we've got.
Right, exactly. Well, hopefully we can change the minds of a lot of veterinarians and get them to understand the value and importance of foundational food to fix problems and prevent problems. I mean, that's really the real goal, is to start them off well when they're young and keep them on that path, like you said, keep them on the road, the straight and narrow, and not have them, bouncing off and having all these GI issues and allergies and all the things that are the most common reasons that dogs and cats are presented to veterinarians: allergies, vomiting and diarrhea, ear infections, and we can get rid of all of that with wholesome, healthy foods. Chris, you are a fountain of information, and I really appreciate you. I appreciate what you're doing with the food, and hopefully changing a lot of minds. And so now we just need to multiply that by, a couple 100,000 veterinarians, and we'll be in great shape.
Exactly. We just need veterinarians to understand it. And the bottom line is, it's the difference between nutrients and ingredients. And you said it perfectly in your introduction. You can get the same restriction of nutrients that you might need for a disease process, but do it with good ingredients. Why can't we use good ingredients? We do. Medicus, we do. But you know why? Because it's expensive. But we put all of our money into our food, and then hope that know that the food will speak for itself. And that slowly but surely veterinarians are going to appreciate that the ingredients do matter. And that's as important as being able to hit the nutrient profile.
Yeah. And, for the pet owner, it's like, yes, I'm spending a little more on food, but I'm not ending up at the emergency room with hemorrhagic gastroenteritis. I'm not ending up at the veterinary's office every month getting allergy shots and medication. And, it's like so much money could be saved on treating disease and could be used instead to promote health.
I think that's
I think
that's the reason.
That's what we need to get.
Why we do everything that we do, because it's so simple. Isn't it just, you just want to scream? It's so simple. Don't make it so difficult. Like, feed them real food. How did we get to this point that we believe?
Advertising.
Oh yeah. It's like advertising and marketing. And if you put nothing into your food, you got tons of money to market and to have a Super Bowl ad and to give lots of free stuff away to veterinarians and buy their influence. And I think it needs to be the opposite. And hopefully in our lifetime, we'll see that change.
Hopefully. Not getting any younger, but hopefully. Well, thank you. Thank you very much, Chris. I really appreciate you. And Medicus veterinary diets are going to be part of the International Naturally Health Experience being brought to us by All Provide, another pet food company that I absolutely adore. And so we're hoping that Chris will be able to be there, but at least her team will be there. Yes. And people who have questions about Medicus diets will be able to talk to the team and get their questions answered. And these are not all just prescription diets. These are also diets that can be fed to our healthy pets to keep them healthy. And that is what we're all about. Good food.
Amen.